Good morning. We will see the remaining portions of the give reasons in medical surgical nursing. The first one, urine output is strictly monitored after renal transplantation. Why? Urine output is one of the most important parameters which are monitored after renal transplantation. The primary function of the transplanted kidney is to filter the waste and excess fluid from the blood producing urine. Therefore, monitoring the urine output critically in assessing the function of the transplanted kidney. Second, after transplant surgery, the healthcare providers will closely monitor the urine output of the patient to ensure that kidney is functioning properly. Initially, the urine output will be low and urine may contain some blood or other material that have been produced during the surgery. However, as the kidney starts to function, the urine output should increase and urine should be more clear. A decrease in urine output may indicate that transplanted kidney is not functioning properly. That is the reason why urine output should be strictly monitored after the renal transplantation. Second question, monitoring the peak airway pressure is important who is the patient is on mechanical ventilator. Peak airway pressure is the maximum pressure generated in the airway during the mechanical ventilation, and it is an important parameter to monitor because high peak pressure can cause lung injury and other complications. When a patient is on mechanical ventilator, the ventilator delivers a predetermined volume of air or gas to the lungs at set rate and pressure. Peak airway pressure is the pressure generated in the airway when the ventilator delivers this volume of air or gas. If the peak airway pressure is too high, it can cause damage to the lungs, leading to a condition called ventilator-induced lung injury. Ventilator-induced lung injury can cause inflammation, fluid accumulation, and damage to the lung tissue, which can make it harder for the patient to breathe and increase the risk of infections. Avoid restraining a patient during seizure. A seizure occurs due to excessive and disorganized electrical activity in our brain. A major seizure occurs when the victim falls to the ground and starts shaking uncontrollably. This is known as tonic-clonic seizure. Victims of a major seizure are normally unconscious during the episode and not aware of their surroundings. One should never attempt to restrain or hold down a victim having a major seizure. This increases the chance of them suffering an injury such as a broken bone or dislocated shoulder. In addition, it puts the person at risk of sustaining an injury. That is the reason why we should avoid restraining a patient during a seizure. Logrolling technique is used to turn the patient after spinal cord injury. Logrolling match consists of two people rolling the same log at the same time with the objective of staying on longer than one's opponent. Logrolling is a method turning a patient while keeping the spine in a neutral position to avoid further injury to the spinal cord. The purpose of Logrolling is to maintain alignment of the spine while turning and moving the patient who had spinal surgery or suspected or documented spinal injury. So, Logrolling is important to prevent further injury to the spinal cord in a patient who already have an injury to a spinal cord. Injection Lasix given in pulmonary edema. Pulmonary edema is a condition caused by too much of fluid in the lungs. This fluid collects in the many air sacs in the lungs, making it difficult to breathe. Lasix mainly works by inhibiting electrolyte reabsorption from the kidney and enhancing the excretion of water from the body. Lasix decreases the pressure caused by the excess fluid in the heart and lungs. Blood pressure drugs this manage high or low blood pressure which can occur with the pulmonary edema. Peripheral pulses distal to the cannulation site checked after cardiac catheterization. During the procedure, a catheter is inserted in the blood vessel and advanced to the heart. This can cause injury or damage to the vessel or surrounding tissues which can result in the blood flow to the distal extremities. So, when we check the peripheral pulse, such as radial pulse or dorsalis pedis pulse, can help the healthcare provider assess adequacy of blood flow to the distal extremities. A decrease or absence of pulse may indicate a blockage or narrowing of the blood vessels, which can lead as a complications as thrombosis, embolism, or ischemia. So, in addition to checking the peripheral pulses, the other measures that can be taken after cardiac catheterization include monitor for the complications like vital signs, assessing the insertion site for bleeding. Warfarin is administered to patient after cardiac replacement. This we have seen earlier by the anticoagulant administration after 1 minute after cardiac valve surgery. Warfarin is one of the anticoagulant. Warfarin is an oral anticoagulant commonly used to prevent the blood clots. Mechanical heart valves are more durable than tissue valves. They are not thrombogenic. So, anticoagulant management after mechanical prosthetic valve implantation will help preventing valve-related thromboembolic events. Anticoagulants is required mechanical valves to prevent the valve thrombosis. WBC count is monitored the patients who is on chemotherapy. During chemotherapy, along with killing the cancer cells, the healthy white blood cells, that means neutrophils, are also killed. When number of neutrophils is reduced, a condition called neutropenia occurs. Neutrophils are the one which will fight for the infection in our body. That means any foreign bacteria or virus enters the body, the neutrophils is the one which fight against them. So when the count of neutrophils decrease, we call it as a neutropenia, and this getting an infection, the rate is increased. Certain chemotherapy drugs can damage bone marrow, which make the blood cell itself. A low neutrophil count leaves the body more prone to the infection, and an infection does develop during chemotherapy. The body may be unable to fight it off. In order to prevent the infection and subsequent complication, WBC count is monitored in patients who is on chemotherapy. Semi-fowlers position is preferred by patients having dyspnea. This position involves sitting upright with the head and torso elevated at 30 to 45 degree angle, which can help to reduce the pressure on the chest and lungs, improve respiratory function. In semi-fowlers position, the gravity pulls the diaphragm downward, allowing greater chest and lung expansion. In semi-fowlers position, the diaphragm moves downward, work of breathing relatively decreases, lung volume and ventilation increases, lung dilatation is promoted. These changes can improve oxygenation and increase oxygen saturation. That is why the semi-fowlers position is usually given in the patients who have dyspnea. Mannitol is administered to the patients who had head injury. Mannitol is a type of sugar alcohol. Mannitol is thought to decrease the brain volume by decreasing overall water content, to reduce the blood volume by vasoconstriction, and to reduce CSF volume by decreasing the water content. Mannitol is a type of osmotic diuretic that works by drawing excess fluid out of the brain tissue and to the bloodstream, which can help to reduce the pressure inside the skull and improve the cerebral blood flow. In addition to reducing the intracranial pressure, Mannitol also can have other beneficial effects in patients with head injury, such as reducing the inflammation and improving the cerebral metabolism. That is why Mannitol is commonly administered in the patients who had head injury. Thank you. Thank you for listening.